Okay, so I'm going to go over a real e-fast exam at real speed like we would do in a trauma patient's evaluation. The first place I would most likely look is Morrison's pouch. So I can go here and I can see, I'm going to adjust the depth as I go along in real time. And here I can see Morrison's pouch. So liver, kidney, and I can see there's nothing in between them. And then I look at the tip of the liver, that looks okay too. And the other thing that I would look at for is I would go up a couple rib spaces and I'd look for the diaphragm and potentially blood up in the chest. And when you're having, there's the diaphragm and I don't really see anything up in the chest. And the fact that you're having a hard time even seeing the diaphragm and above the diaphragm is usually a sign that you don't have a hemothorax, because if you had fluid up in the chest, you'd have an easy time seeing the whole diaphragm. Then I would go to the left upper quadrant. I'd do the same thing. I'm looking for the spleen, and the spleen is crescent shaped right here. Here's the lower tip of the spleen. I'd look around that, and then I'd look at the diaphragm and above the diaphragm and make sure there's no, kind of go up and make sure there's no fluid above the diaphragm. And again, I can only see the back side of the diaphragm from about the center of the screen back, and the fact that I can't see the whole diaphragm up here is actually good, because with a big hemothorax I would see the whole diaphragm and black fluid above the diaphragm. The next place I would probably go is the pelvis, so I would go longitudinally or sagittally in the midline, and I go way down low just above the pubic bone. I'd adjust my gain so that it wasn't too bright behind the bladder, because that's a problem if you're trying to see blood behind the bladder. And what I'm seeing here is his prostate here, seminal vesicles here. If I go to the lowest point of the bladder and behind the bladder to the left, that's where I'd look for free fluid, so right in this area. And if I hold it really still, what I'm seeing is bowel in this area. And again, turn the gain way down and make sure that you don't see any black fluid collection right here. The next place I might look is his heart. Now, in penetrating chest trauma, I'd probably go to the heart first, but in a normal fast exam, I'd probably go to the heart in this order. And then you can see in the subcostal position, in a fairly good-sized patient, you don't want to, you have trouble seeing his heart unless you have him take a really deep breath and hold it, and then you'll probably see the heart come into view here. I have to go way up here to see it. Okay, so I'm looking through the left lobe of the liver here. Here's the right ventricle. Here's the left ventricle, and then I'm looking in front of the heart here. There actually might be a little hint of an effusion right there, but I'm going to look around the front of the heart here and around the apex. And a big effusion will go down the back side also. So, and I can look at the left ventricular, gross left ventricular function right here. I'm going to turn my gain up a little bit. And you can see as he takes a deep breath in, I get a much better image. And just by convention, the apex is to the right side of the screen here. But if you do this backwards, it's not a big deal. You still get the same information as long as you understand what you're looking at. The next place I would look is for the sliding sign. Now again, if a patient's short of breath when they come in, I might look at the sliding sign first. But what I'm doing is I'm going in the second or third intercostal space, mid-clavicular line, and I'm looking for this bright white line, which is the pleural surface, between two ribs, which are here, here, and here. And then I can zoom, or I can decrease my depth to look at that more closely. But I'm looking for sliding right along that line. If I hold the transducer really still, I can see sliding right here along that line. And so I look there, and then I go to the same place on the other side, and I look for that white line sliding there. So you can see in real time, you can do this whole exam very quickly. And I could probably do it in half the time if I wasn't talking about it while I was doing it.